How do you ensure lipomas are fully removed? Good question. Surprisingly good question, this from a patient. That's a good question. And you kind of might think it's obvious, and sometimes it is obvious. Sometimes you do it and there's a lipoma and there's a lesion and it comes out nicely and you kind of pretty sure you've got it all removed. But often you find that they're in little bits and there's sort of fingers out to the side and bits and bobs, and they don't come out. Sometimes they pop out really well, and especially the small ones. But bigger ones often don't kind of pop out. You have to kind of cut them out. You have to look for a plane. And usually there's a pretty good plane, but you could potentially go into the lipoma. And if you're cutting into the lipoma, could you potentially leave a bit behind? And, could you potentially have left a bit of a finger somewhere? Yes, you could. And yes, I have. I'll be full disclosure, honest with you. I had a lady with one on the back, and I had to go back and remove the rest because 6 months later there was kind of still a bump there. It was a big one, mind. Well, maybe not that big, but it was that big. Well, maybe that big. Exaggerating on the camera. It was big though. That is big for a lipoma on the back under local anaesthetic. So in answer to the question, how do you ensure? Well, you just look and you try and stay on the lipoma and try and stay in the plane so that you get all those fingers coming out, but you're grabbing it with your forceps, and sometimes when you grab it with the forceps, it breaks a bit, and so then it's more difficult to sort of, once it starts breaking up, you're like, God, it's breaking up now. You've got to try and keep it in one piece. So that's, I guess, for me anyway, the main way that I try and get it all out completely is I try and keep on it and try and keep it intact. But there's always a balance because you're trying to pull it, counter traction, where you're trying to pull it out with the forceps and you're either using a knife or scissors to cut it out, and you want that good bit of counter traction, but not too much that it breaks apart. And sometimes it does break apart, and sometimes it's difficult to know whether you got it all out, especially a big one on the back, on the neck, places like this when they're quite stuck in and you have to cut them out. But the answer is we look to make sure we fully removed it, and without being too sort of like gory or whatever, you just sort of put your finger in and try and make sure the pocket is clear and you can't really, outside and inside, make sure you can't feel any more lumps. So usually, obviously, have got a pretty good idea that you've removed it all, but it is not unheard of to miss a bit. Let me put it like that. It's not common, but it's not unheard of. And so I normally say, look, it does swell up afterwards. So don't think, oh my God, he's missed a bit, because it will swell. You've got to leave it a few months. And if in a few months' time, so at least 3 months really, if there's a lump there, no problem. We'll go back and just remove that lump. But usually the lumps are swelling, which usually